So lovely. So I came across this video on my For You page on TikTok, and I thought to share with you guys where our doctor decided to ask a question directing to Black community. He went ahead to ask about why is it that anytime, Black people goes to these doctors for examination, especially when they come to his office, they come along with either their friends or family, or even rather, if they can't put their hands on those people, they often come with a phone that they can be able to do a FaceTime with either a brother or sister. And a lot of people actually stitch his video, and I was just able to put them together. I'm just going to roll the clip as well as some of the stitches I was able to put together. Please leave me your own thoughts in the comment section and let's dive into it. But before then, don't forget that this channel will do not support any form of bullying, harassment, or whatsoever. We're just here for educational purposes. If you're new here, my name is Ballistic Juice. Please subscribe, share, and let's dive into it.
So this is Dr. J Mack, and he has a question that I'm going to help him with. Let's take a look at his question.
I have a question, but I'm afraid to ask it because I don't want to be labeled as a racist. I've gotten backlash before online, and it's horrible. But here we go. I've been an ear doctor for 10 years now, and a significant amount of my African American patients, while I'm doing a history and physical to understand better what's going on with their problem today, they have someone on the phone. They're either just talking on the phone or they're on FaceTime, but a large percentage of my African American patients have someone that's there in the room even though they're not there in the room. Why is that? When I, myself, not speaking for an entire race or ethnicity, have a doctor come in, I hang up my phone. Am I an outlier, or is this a trend that other people have recognized? Also, if you are from the African American community and you do think that this is a thing as well, why is this? Is this for emotional support? Is this to make sure that they're being treated fairly? I genuinely am curious, and I'm really hoping I don't get backlash for this.
I find it hard to believe that you don't know the answer to that question is yes to both of the things you said. This is medical apartheid. I would also advise you to pick it up and to understand the distrust that Black people have for doctors and where that distrust comes from. Now, I'm sure somewhere along the line in your studies to become a doctor, you have heard of the Tuskegee experiment, which for 4 decades, from 1932 to 1972, PHS systemically studied 400 men with syphilis and used another 400 men, all Black men, as a control group to understand syphilis while lying to the Black men about that experimentation. And when one of those Black men became suspicious of the treatment they were given and started to look for treatment on their own, they were prevented from seeking that treatment by PHS. Just in case you didn't know, PHS was Public Health Service, and it was a precursor to the CDC, or the Center for Disease Control. And then there's Henrietta Lacks, whose cancer cells were used without her permission or her family's permission, and neither her or her family was compensated for their use, as they gave birth to an immortal cell line known as the HeLac cell line. Yeah, that was a thing also. Now, Dr. J Mack, I would also suggest you go read anything by Dr. Joel D. Howell here, where he talks about racial disparities in medical treatment. You could have also Googled Understanding Black Distrust of Medicine, and this article by Dr. Joel D. Howell would have came up, which he states, one of the most visible ways racism was made manifest was in multiple instances of physicians carrying out unethical experiments using African Americans. He further goes on to state, all healthcare professionals need to know about these experiments because they can offer insight into why many people are distrustful of medical systems. I have 3 suggestions for you that may have prevented you from answering this question in the first place. Pick up a copy of Medical Apartheid by Harriet Washington, read an article by Professor Howell, or you could have found a Black physician and ask them that question for yourself. Now, you have the day you deserve.
Girl, it is tiring to listen to people fix their face to say something racist, but then preface it by saying, well, I don't want to be labeled as a racist. Don't be afraid then. Don't be afraid. It is what it is. Just accept it and let the feeling wash over you. Get comfortable in the feeling. Now, I'm going to say what I'm going to say slowly. So I apologize because I know the citizens of TikTok like things fast because our attention spans are short. But I want to take my time in saying this because, you know, when Black people say things a little too fast, a little too punctuated, you know, it gets labeled as being too sassy, too angry, too sensitive. And, you know, I don't want to be labeled as any of those. So I'll take my time to answer. Now, as a healthcare provider in this country, I'm sure that you know that there are unfortunate cases of practitioners essaying patients while alone. And I'm not even going to say there's more Black people that experience that. It shouldn't be happening to anyone. But number two, with regard to Black people, we experience a disproportionate amount of adverse medical events in the United States. So once again, as a healthcare provider, if you don't know that, then you should know that. You can verify what I'm saying by looking it up in the Lancet or in JAMA. Now, with those two reasons laid out, a second set of eyes, ears, and a voice in the room serve for a couple things. One, as I alluded to before, as a safety measure. Secondly, just as an overall sense of security, particularly for people who are acutely ill. They may forget things. There may be symptoms that they have mentioned to someone else, likely the person that's on the phone with them, that can help during your interview of the patient. This other person can also ask clarifying questions. This person on the phone, although both you and the patient may speak English, some healthcare providers can get carried away with the medical jargon. And even if you do take steps in your bedside manner to not do that, we're not all on the same playing field with regard to literacy. And an extra set of eyes, ears, and a mouth in the room can...
Beyond the fact that you literally just opened up the floor for racism in your comment section, whoop-de-doo for you, I'll answer. We don't trust y'all. As someone who has been chronically ill for a very long time, I learned very early on in my life as a child and going into adulthood that there were certain points where I could not go to the doctor and not either have someone in the room with me or on the phone with me. Because the way so many doctors, especially doctors, go out of their way to gaslight you, to condescend to you, is insane. And many of my worst experiences have been when I was unable to have some type of advocate in the room or on the phone. At some point, y'all are gonna have to stop asking why we operate differently within a system that wasn't created for us. Many of y'all, to this day, still do not believe that Black people experience pain to the same degree that white people do. I mean, we literally have just been dealing with the drama from a Black healthcare professional telling Black women that they cry wolf at the doctor. And y'all wonder why we come in and make sure that we're not completely alone? Are you kidding me? The rate at which medical professionals choose not to believe us, choose to gaslight us, and choose to lie to us is beyond heartbreaking. And therefore, you will never catch my Black ass in a doctor's office without somebody there to listen. And I don't care how you feel about it.
Doctor, they killing me. Nicki Minaj 2014. The girls that get it will get it. But for the girls that don't get it, for the girls that are not thinking with their third eye, for the girls that are not thinking at the fourth dimension, the healthcare system and the justice system are parallel in terms of how they treat Black people. In fact, there have been so many anecdotal cases, this mistreatment happening in healthcare. Literal studies were conducted, and their findings, let's just say nobody was lying. So yes, don't act shocked. One thing about us, we're going to have our entire family on the phone, Facebook Live on our iPads, and the NAACP on email, because we have to be real. Some of y'all like to lie. And it's not just with doctors. Everybody think of two of the most vile human beings that you went to school with. Are they a nurse right now?
The maternal mortality rate in the US for Black women is 2.6 times what it is for white women. When a Black person in the US has Lyme disease, they are significantly more likely to receive the incorrect antibiotic the first time around than their white counterparts. When a Black woman has breast cancer, it is likely to take much longer to receive the correct diagnosis and begin treatment than it is for a white woman. Some of this comes down to access in healthcare and insurance, but a large part of it comes down to discrimination in the American healthcare system. Pain and symptoms for Black Americans is far more likely to be dismissed and ignored. If you are entering into a system where you know you are far more likely to be ignored and dismissed, you're going to want someone there who is able to witness that and call it out and stand by your side. I think it is unethical for a medical professional to pretend as though they are unaware of these biases in our system. Beyond that, creating and further perpetuating stereotypes against a group that is already at a disadvantage in this system goes against the promise to do no harm.
So he basically says in the video that he wants to know why a lot of his African American patients bring somebody else in the room, even though that person is not like contributing to the conversation and whatnot. They'd be playing on their phone or whatever. And I will tell you the answer. Is mistrust in the medical system, because doctors do not believe a lot of their African American patients. Now, there are tons of studies and tons of articles that you can find online. One of them is AAMC.org, and the article is called How We Fail Black Patients Pain. Now, this article was written in January of 2020, okay? So, not too far back. Now, there are quite a few lies about Black patients and our pain. For one, a lot of us experience doctors that don't believe us. There's a study that shows that Black people were 22% less likely to receive pain medication as opposed to a white person. And hell, there was one time when I had a blood clot that traveled upwards and I was in so much pain, they would not give me any pain medicine. But the old white lady next to me who was walking, she said, "Oh, I fell and my back hurts." And I heard them, "Oh, we'll give you some Percocet." There's also a study that shows physicians were more likely to underestimate the pain of Black patients, which is 47%, relative to non-Black patients, 33%. There are still medical students who believe that Black people have thicker skin than white people, that Black people have a different pain tolerance than white people, and that's why they don't prescribe medications and whatnot. And this dates back a long time of white doctors not believing Black patients, or even worse, white doctors performing procedures on Black patients without any anesthesia or anything like that. There is a man who's considered the father of gynecology, and what he did was practice on enslaved women and with no pain medication. That's great, isn't it? Hell, when I had a stroke, my husband got me to the hospital in like record time, and he ran in apparently, got a doctor or got a nurse, and they came out to the car to try to get me because I was slumped over. And he's telling them she had a stroke, these are her vitals, blah, 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 because he used to be a paramedic. And they just kind of brushed it off. They said I was drug seeking. And then they decided, oh, we're going to do a lumbar puncture. And they did it wrong and messed up my back because I have degenerative disc disease. So even though I was having a stroke, even though I couldn't talk and I was just slumped over, these doctors honestly believed that I was faking it, and they would not give me anything. A few years later, when I had a subdural hematoma after getting a procedure done on my back, basically the spinal fluid leaked, and that caused a lot of pressure in my head, and I literally could not sit up. So, I call my pain management doctor. They're like, "Oh, you just need some caffeine. It will get the headache away." That did not work. Then they said they're going to do a blood patch, which is like they inject your blood into your spinal column or something like that. And that worked for a few hours. But at the point where I was at my mother's house for a barbecue and I was laying on the floor, and they were like, "Okay, food's ready," and I did not want to eat. My family knew there was a problem, and they were like, "Get to the hospital." So we're at the hospital, and I'm sitting there, and I'm laying down, and I'm saying, "Listen, the pressure in my head is so bad, and I'm so nauseous. Can we just stop the pressure?" And they gave me the anti-nausea medication, but not anything else. It wasn't until they did the MRI and they saw the big black line in my brain, which was the blood, that they basically said, "Oh shit, this is serious," and then put me on a Dilaudid drip. And I was hospitalized for 4 days. I was on Dilaudid and all that. But the point is, I have been through some shit, and damn near every doctor that I have seen has not listened to me, has not, trusted me in what I'm saying is happening with my own body, and they just are dicks. That's it. So the reason why a lot of African American patients bring somebody in the room is so that we can have a witness of what the doctor is doing or not doing, actually, and somebody to advocate for us if we need it.
Basically, the medical system is still racist and holds a racial bias against black people.
Like, seriously, lovelies, when I saw this video, I was like, is it that this guy is not informed, or he's just being ignorant, or he's trying to, form ignorance, or he don't know what is actually going around in this world, or in this present time, or in the society at large. So he wanted to tell me that he did not know the way at which, there's, black women or black people has been treated in the healthcare sector. He don't know the kind of negligence that is happening, or that is been in the health care system. Just was it last month ago, it was reported that a lady who happens to be a content creator, lost it all because of something that they can actually avoid. So this lady in question has been going to the hospitals frequently for an illness which the doctor because she is actually a black woman, and the doctor decided that okay, she had fibroids, and that was a very wrong diagnosis. And this is something that has been going on in her life for the past years. Like, it all started, I think she said, far about 2019, and she's been going to this hospital for a treatment of maybe fibroids and all of that, and she's been taking tablets until when it's now become so severe sometime last month, and she collapsed in the bath, and the husband have to rush her to the hospital, and after which they diagnosed that she had a cervical cancer, and this cancer has gone from stage 1 to stage 3. And this is something that, assuming for the first time she was not neglected, they could have actually dictated that she never had fibroid but cervical cancer. But because of the negligence, or because of okay, I don't care thing, she was actually neglected, and she was told that okay, it's just a simple fibroid that we can just fix, and all of that, until when this thing has actually developed from stage 1 to stage 3 of cervical cancer. And this woman in question happens to have 2 younger babies and her husband, and now we've been told that this woman have actually lost it and all of that. And this is one of the recent cases out of the thousands of cases that is happening in the healthcare system. So you wouldn't blame these people when they actually come for you for these examinations, and they decide to actually, okay, I am coming for this examination, let me come with one of my colleagues. And also, I wouldn't blame anyone to actually, first of all, to check out what is actually wrong with me online. Google and check it out before actually going to these hospitals, because the rate at which we are neglected, especially in the healthcare system, is something that even a blind person can see. Talk more of a dear doctor, and you know the way at which this healthcare system treats people of my own, and exactly what is happening in healthcare system. You wouldn't tell me that you are not aware of how it is. You wouldn't tell me that you are not aware how negligence these people have been led. And because of this, all of these people decided that they want to go there, especially if you are even a pregnant woman. So there is one of these, people that are sharing their stories and the horror stories of their birth stories, on how they were neglected and how they were actually, forced to go through CS, which they were not supposed to. So this woman decided to share her story because of the third question. So this one decided to share her story, how she was, pregnant for the first time. She went to these doctors, and these doctors like, okay, you're gonna go on for a C-section. And she didn't have my, or like, why would I go for a C-section? And before you know it, she was actually first to do that, and she ended up with all of the controversies and all of that. Then she took in the second time, and she went there. She was also told that okay, it's automatically, but in her mind she said that she actually wanted birth normal. They have to leave her there that okay, if you want to bed, you want to try, just do it. Until when she keep on, crying and begging that she actually wants someone that understands her to come to her rescue. Until every other thing, a doctor who happens to be of her same race decided to come to her aid. And she, the doctor actually gave her a chance to, do whatever she do. And she finally gave birth, VGC, like birthing before, after, cesarean birth. So this thing is something that is alarming, and if you don't take precautions like this, like going with our loved ones or going with our friends and families and all of that, cases like this might actually repeat itself, because the way at which they neglect these women, the way at which the diagnosis is just is they'll tell you that something like this is something that usually happens, it occurs. So when it occurs, why is it that it occurs in a particular race? It doesn't occur with every other person, but it occurs in a particular race. A lot of women have shared their stories, their horrible stories, their bad stories, and the more we listen to this, the more we have the privilege, the more we actually want to go out there or go to these dearest people with our phones, our family, and well wishers. Because if you are maybe unconscious and all of that, it's actually your friends and family that will be there to watch your back, because you wouldn't trust these people. You wouldn't, and this is just something that is just there. So I wouldn't blame this, your patients and all of that for coming there with their families and friends and or FaceTime. They are doing this because they do not trust you. They do not, and you wouldn't blame them if they don't trust you. And I am even shocked that you are coming out to ask these questions, because this is something that have been on internet. Just check it out yourself. And why not probably maybe ask your patient? Could have asked the patient, why is it that you do stuff like this? Why is it that? Then they can probably tell you the reason why they have to go to such extent to protect themselves. Because if they don't do that, no one is going to do that for them. So I believe this thing is just something that is just, that is very common. And people know the reason why. You yourself know the reason why, even if you feel that you do not. Like, a lot of people actually stitched his video. A lot of people called him out. I think he did a second video trying to apologize and, trying to let people know that, okay, I think I understand why the Black community does this. You should be able to understand. You should be able to know what we pass through, what these people go through. It's just everywhere. But the healthcare system, I think, is just the worst. Especially, pregnant women and all of that. Why is it that there are so many, high mortality compared to these other races? Why is it that it's high in the Black community compared to this? So this is just something that is over there, and what everybody needs to really work into or need to work towards. Seriously, there is a study that shows that a healthcare provider that happens to be a Black person, does a better job with a Black person compared to that of a pan-colored person. So the study shows that. This study also shows that a dominated pan-colored Black places with Black doctors have, high chance of survival and high chance of, healings and all of that compared to this other. So it's just something that has been there for a very long time. The studies have shown this. It's not something that is so, oh my God, why is it like this? It's so shocking. It's something that has been there for a very long time. Anyways, lovelies, why not just leave me your own thoughts in the comment section of what you think of this video. And do not forget that we do not support any form of bullying, harassment, or whatsoever. We're just here for educational purposes. So please, share this video, subscribe to this channel if you are yet to do that. And I will see you, lovelies, when I upload the next one.